Great. That's great. Well, thank you so much for coming online for this telesummit.
Great, thank you.
I'm very excited to be speaking to you because I think this is a very timely time for us to consider where we can go in this moment into how to create the future. So I'm so honored. I was just looking at your Nurse Manifest project and realizing there's been a lot going on in your life to sort of, get activism, get nurses to become activists for a long time. So I'm very, very excited to be speaking with you.
Thank you. I'm glad to be doing this.
Great, great. So let me introduce you to our community. I wanted to introduce you. You had worked at the University of Connecticut and now you're living in Oakland. You're the founding editor of Advances in Nursing Science and the authors many books and articles on nursing theory, feminism, and nursing, the art of nursing and nursing education. You also are the co-founder and web manager of the Nurse Manifest Project, which sounds so exciting. And that is to inspire and empower grassroots action by nurses to shape the future of nursing and healthcare based on nurses' fundamental values. It's exactly what I want to hear about today. And also you're the co-founder and web manager of Nursology.net, which was established in 2018 and focused on peace and power, cooperative group process, and grounded in critical feminist theory and nursing philosophy. So I'm so excited to be speaking with you because this sounds absolutely fantastic. So I would love for you to talk more about your work and how and really I'm excited to think about how we can do things as activists and at the grassroots level. So what are some of your recommendations and vision for the future of nursing and what we can do to manifest healthcare in the future?
Well, one of the things that I've been really concerned about for really all of my career is the devaluing of nursing in our society in general, but also within our own nursing profession.
Right.
And our failure to really, our drift really away from nursing's core values and ideals and looking to other disciplines,
Right.
which often places us in a handmaiden role to other disciplines where we are using our energy and our time to meet other people's goals and ideals
Exactly.
and not our own. And nursing has neglected to even help young people entering the discipline to know what our own values are.
Right.
Even though most people, I believe, come into nursing with a sense of, I mean, the most common phrase I've ever heard is, I wanted to help people.
Yeah.
So, you can do that in a lot of different ways in a lot of different professions. Almost everybody who is in any kind of occupation or profession that serves the public is helping people in some way.
Right.
So people generally don't come into nursing exactly knowing what that is, other than whatever public images they have of nurses and nursing, which are not the most complimentary, or nor do they really display the kind of knowledge base that we really bring to what we do to help people.
Right.
So our education programs had begun to drift away from even teaching the basic theories and perspectives of the discipline.
Right.
Most of the education curricula are designed around a medical model, which really there is no such thing as a medical model except for dividing the body up into parts.
Mm-hmm.
And, teaching about children and medical surgical problems and psychiatric problems. I mean, the part thing is just overwhelming.
Right.
And it becomes so integral to what we are trying to be all about.
Exactly.
So we I've been concerned about that for a long time, which was part of the interest I had at the very beginning of my career when I first started working on theory in general, what it is, how it informs what we do. But I also have been very committed to putting into action what we really value and what we think. I kind of grew up with this hypersensitivity to hypocrisy.
Right.
And I really believe that if we said that we value something like love our neighbor as ourselves, then we should do that.
Right.
And even from that quote, you can guess that my background is in a very Christian tradition, Judeo-Christian tradition. So the failure to put that into action is so prevalent in so many ways in our culture. But in nursing, we have not only failed to put our values into action often, but we have failed to even know what those values are. So the Nurse Manifest Project and the manifesto that we developed in actually the early 2000s
Right.
was intended to bring to the forefront what those values are and help to reinforce the beliefs on which we believe nursing is really founded. And we, at the time, was Richard Cowling, Sue Hagedorn, and myself. And I had just started to, in the late 90s, learn how to work with websites out of concern for the fact that women's voices were missing from the internet.
Right.
And the nursing was practically invisible. So we just realized that if we did this, we didn't have to go through the publishing process and
Exactly.
or write a book or anything else. We just could put it up on the web.
Exactly. So tell me
And
what the values are so everybody understands that that's listening.
yes, well, some of the values that we tend to talk about, like caring, are still too uh, uh, abstract to really know what that means.
Right. Okay.
But the value of knowing the person
Right.
in one of the and knowing the person, not the disease or the treatment or anything, but really knowing what the experience is of the person.
Right.
And being responsive to that experience. And so you can, my language is kind of mixing action and value, but the commitment to really know what that is just so strong. I had an opportunity to talk to a staff nurse who was arrested for preventing the police from taking blood from her patient in ICU who was comatose and couldn't give permission. And this was on the news at the time that it happened. So I asked her, in such a complex situation, because we were talking about what that experience was like and what
Right.
the ICU situation looked like. And I asked her, what is it that you bring as a nurse to that situation? And she answered without a moment's hesitation, we are the ones who know the patient. And then I thought she was going to say something about we're here to protect the patient, which she did get to, but she didn't start with that. And I felt that was really a significant indicator of what our value is, that we value making a connection, understanding, and we bring to that something that is unique to our discipline, which is knowing the physical, the medical, the kind of healthcare experiences that people have in a really holistic way. So we understand what's going on with the health challenge that they have. We can help them understand it. We are able to connect to the whole of the experience.
Right.
if we're working from a nursing perspective, from the deepest values that we don't ignore the other people in the room, which
Right.
is one of the most common travesties
Right.
of the medical system. Uh, I've even taken my granddaughters to medical appointments and nobody asks who I am. They don't acknowledge that I'm there. Clearly, I'm not a parent
Right.
with my gray hair,
Right.
but you know, uh, to try to take care of somebody and not even know the people in the room is just
Right.
incredibly neglectful.
Yes. Yes.
So, from a nursing perspective, that would never happen. So these values translate into what we do. And so that's why the focus on activism is so strong in terms of the Nurse Manifest Project. And it's just kind of been a sleeper. It's been on the website. People discover it from time to time. It inspires people. It kind of gives people uh, affirmation of what they've always felt and known.
Right.
But, it hasn't been glitzy,
Right.
flashing lights kind of thing. It's just been there. And we've managed to put together some actual projects from time to time.
Fantastic.
Yes, just not, we don't feel that the people who have been most involved in establishing it, are responsible to do that. We really mean it when we say we want to inspire grassroots action. And whatever way that people can express taking action to promote the values that ground nursing is wonderful. And many of those actions take place outside of what we would call the Nurse Manifest Project. We're not into making any money. We've never collected a dime. We don't have any kind of interest in anything other than the inspiration and the bringing to awareness what it is that nursing is all about.
Well, that's exactly what I want to do with this telesummit. I want to reach out to as many nurses as possible. And it's so exciting to me that you have a nurse management project that is there to continue. That's obviously there as a continuation of what this telesummit, because my interest is how can we reach and inspire as many nurses as possible to create the future, many times from a grassroots level outside the system, based on what it is we truly value. So I'm very excited to hear about that. So tell me how if you get involved in it, is it something you're looking for? What are some of the grassroots projects that have happened that can be exemplars to inspire other nurses?
Well, we had an activism think tank in the summer of 2018.
Right,
And there were about 50 nurses there.
right,
And they all came together because I initiated doing that because I had met several young women who were just entering their career, and they were already concerned about the um, lack of social and political awareness that they experienced in their undergraduate programs,
exactly.
and the lack of focus on what they felt, just even coming into nursing with more of I just want to help people kind of idea,
Right, of course.
that they wanted to, that they saw as the potential for nursing in the kind of social, uh, uh, political work they wanted to do related to health.
Right,
And so they already kind of saw that potential in nursing, but as they went through their programs, it was totally missing. And so I felt like I wanted to, I knew that all of these people were out there, but they were scattered all over the country
right,
and didn't know each other. And so we put out a call through the Nurse Manifest Project.
right,
Uh, and we had far more than 50 people who were interested, who wanted to come, but 50 was a good number. We were able to sit in a
right.
circle and discuss various ideas and interests. And out of that, about, I would say, actually everybody there has gone forward in some way. Some of them are working on projects related to a particular health issue or
Mhm.
threat, like gun violence in schools or
Right.
something like that. But it, uh, they made friends, they made connections with one another to
Yes.
continue to inspire one another and to move forward. And actually, part of that, at the time of that think tank, we were also in the process. We were about 1 month away from launching the Nursology.net website.
Right. Right.
And so that website is actually an activist project as well,
Okay.
because of the fact that people do not know what nursing stands for and the rich heritage. And even for those of us who developed the site, who are
Right.
considered to be, quotes, experts
Right.
in nursing theory, we learned heaps. There were theories that were there that we knew were there maybe, but most of us found several that we didn't even know existed, uh,
Really?
because they are so hidden. They just reach a particular like small circle. They come out of research that different people are doing, or uh, mostly the research or scholarship that people are doing, and they carry on with their research projects, and nobody really acknowledges the fact that what they are doing is grounded in this really, really important philosophic and theoretical foundation. We also were under the impression that there had been no nursing theory conferences for a
Right.
long time.
For a
And we
long
wanted
time.
to revive that idea, and we did. But we also found out that I mean, this is like we knew with scattering, we knew that the human caring Gene Watson
Right.
people were meeting and doing things, and we
Right.
knew that the Listerroids people were doing things. But when we put it all together, we found this really, really rich, larger community, almost like a nation of different perspectives that are all grounded in a core of nursing. But they bring to it the richness that our discipline really represents. And so Nursology, when we started putting it together, gathering information about the various conferences, and giving people access to really reliable information about nursing theories. Before this, if somebody went to the web and searched for Martha Rogers, for example,
Right.
they would typically find PowerPoints that graduate students had made to report on what this theory was about, if they had been so fortunate to be in a program that
Right.
had a course that helped students know about this. And very, very few of the theorists, Jean being one, have their own website or their
Right.
own organization that has some visibility, but most of them don't. And so um, we were just really concerned about that. And now what we're doing is every Tuesday morning we have a new blog post
Right.
that is related to the development of nursing knowledge in some way. And now that we're in this pandemic situation,
Right.
the blog posts every week are focusing on a particular perspective that a nursing theory brings to how we deal with the pandemic and what we are doing. So for example, the current blog post focuses on Patterson and Sterad's theory of humanistic nursing, uh,
Right.
which is really the person who wrote the blog post is talking about how important it is to hold on to that value even behind the PPE or whatever you're having to do in the really amazing experience that people are going through with what we're doing. But the human connection is still so vital and so missing when a person is so sick that they have to be in isolation and the only people who can approach them look like snow bunnies or
You
something.
know it.
Just, it's a horrendous experience.
So this is so exciting. So you've created something called the Nurse Manifest Project. And this is where people can get involved in a group of people who are activists. And what you also created was a think tank, which I thought was a really fantastic idea. And there seems to be right now, we need to come together as a collective. And then the Nursology is how we can identify the theories and the values of what is the basis of our practice. Is that sort of what we're
Absolutely.
doing?
Yes.
Okay, what my thoughts are is how can we reach out at this time when nurses are the forefront of what's happening? How can we create through the web, through internet? I'm doing this telesummit to reach out to as many nurses as possible. If there was some way, I'm just making this up as I say it, is there some way that we can create this collective? And how can we do that? How can we become, so much of what I see in nursing is we belong to specialist associations, or we belong to academic associations, or the American Academy of Nurses. They have their very specific agenda, but I feel like we need a new agenda. We need a new agenda. We need an agenda based on activating the future. Can you speak to that and how you see that we might be able to do that right through some of right already with what you're doing? How can we build on that?
I think that there's a huge potential for it to happen, again, from a grassroots level. As nurses, I've always watched how nurses appear in the media.
Right.
And now that they are interviewing a lot of providers, the great majority of the providers that come to the mic to speak are physicians, which is fine, but at the same time, everybody is acknowledging that the real people at risk are the nurses.
Right.
Not that physicians aren't at risk, but nurses are the ones who actually go in and out of the room over and over, stay in the room, or really are see people before they have any protective equipment.
Right.
So and there's other people like the people who are working at the intake desk, who are clerical workers that are at huge risk. I believe that we're going to that our discipline as an occupation is going to be seriously damaged from this, because now we have a kind of a population of nurses who realize that they can take care of themselves.
Right.
And to continue to do this work is just too high a price to pay. So I don't know how long we can sustain. And as Joanne Ashley said many, many years ago, that because nurses have been stuck in hospitals as employees,
Right.
that we are kind of at their mercy. And they can, or they could develop a workforce that does just the physical work that is involved. So we are at a point of real crisis and danger for our profession, for our discipline. But I also believe that the dedication that many of the nurses have who are doing this work and who do come forward to talk to the public about what they are experiencing shows through really clearly in terms of what they really believe. And I think that as a result of this, many will come away realizing that what we are all about and what we are doing is just vitally important, and try to find a way to put it into action. And there's many ways to do it. I think that the main message is to help people know that there is a support network out there, that there's other people. Other people may not be ready or willing to join what a particular person's passion is. but knowing that they're out there and able to connect and talk about the, you know, the challenges is really important. So any way that we can do that, I think, is so important.
I think that's fantastic. And I think I'm so excited to connect with you because I would like to be, now I know what's out there and that you have this organization that can inspire nurses at a grassroots level. And that's to me what we need right now. And if you have that building block that we can build on, this is the time to get involved in the Nurse Manifest Project and what we can do as grassroots level and get together. I mean, one of the things I really think about, empowering nurses to take the reins and speak up and make the difference. We have been in a position in our profession that we haven't been taught to do that. We haven't been inspired to do that. And now's the time that we need to stand up and make that difference because this is what the world needs. We're the only ones in the position that we're in, and we can make a huge difference. That's what this whole thing is about, how we can inspire people to know what to do next and to stand up and do it.
Yes, absolutely.
Thank you so much. This has been such a great honor to speak with you. And I just want to say thank you. And I appreciate you so much for doing all the work that you've done and beginning this work. And I think it's only the beginning. You know, I know that as an innovator, I love being an innovator. I know it takes 10 years to get something into its, you know, getting out there. So we have time to make this happen. And
Yes.
thank you so much for creating the platform that you have.
Well, thank you. And thank you for this opportunity to talk about this work and for the work that you're doing.
Thank you so much. And I'll be in touch.
Okay.
So great. Okay. Take good care.
Okay.
Bye-bye. Thank you.